and welcome everybody. We didn't hear from everybody yet, but that's okay. Also, I am very casual, and I think Laurel is too. So we are we're open to questions at any point in time. I have a PowerPoint which I'll show you, but I don't care if we stop the PowerPoint and just discuss, because I know that a lot of you are from Pierce County, and Highline College might be a long way to come, as Laurel and I know very well, because we live in Pierce County and we work at Highline College. But speaking for myself, there's a reason that I'm willing to schlep all the way up to Highline every day, because I think it's a really special place, and I've worked there for a long time and I like it a lot. And that's why I do come a long way to Highline College. How about you, Laurel?
Yeah, I really like Highline College, and I've been there since 2005. I am a Highline College medical assistant graduate, and I worked as a medical assistant for about 13 years. And then through various people that I knew, they said, what about teaching at the college, teaching your profession? And so I came and I've stayed.
Yeah, you know what? That's not in the slideshow to talk about teaching, but think about that too as you're thinking about healthcare careers. Whatever you start in can always evolve, right? So they always need great teachers in all of these fields. So whatever you're thinking about now, if you also love teaching, you will be teaching someday, at least in the healthcare field. You'll be teaching patients every day, that kind of thing, how to take care of themselves, how to take care of their loved ones, things like that. But also, if you want to shift gears later on, you can go and teach the profession like Laurel did. Yeah. So anybody have any questions or things that they want to talk about right now before I just launch into the Highline College spiel? All right. I will start sharing. And all right, everybody see the first slide, Highline of healthcare pathways at Highline? Laurel, yeah, good. Yeah. Okay, because I can't see things. Okay, so yes. The first thing I want to talk about is that we have a summer program called Healthcare Exploration for Youth. And I will put the link in the chat at some point, but this is a 7-week program that gives you the opportunity to explore different healthcare careers, kind of like you're doing this week, only all summer. And in addition to exploring different healthcare careers, you learn some basic healthcare skills, like how to take vital signs, which is blood pressure and things like that. You learn about the careers. You get a jump start on college by having a college success class. And then, because almost all healthcare careers rely on a little bit of math, there's a little bit of math assistance and math tutoring or there's a math class in there that's about personal finance and your own personal math. Your own personal financial situation and how to get funding for college and stuff like that. So in non-COVID times, we take field trips to different schools and different healthcare facilities. Nowadays, we'll probably do it virtually, but we've been having, last summer, we had a really good time. We had people come into the Zoom classroom, and the students got to go to campus even last summer. And this summer, you will be going to campus as well. So anyway, that's called HEY, or Healthcare Exploration for Youth. And I think you can see the link at the top, but I will also at some point put that in the chat if Laurel can remind me at some point in time. All right. All right. I don't know if people have talked to you about these general questions before, but these are things for you to think about when you're deciding what kind of career you want to embark on or what kind of education pathway you want to do. First of all, what kind of work would you like to do? When I say that, I mean, do you want to be using your body every day? Do you want to be touching people? Do you not want to touch people? Do you want to be behind a computer every day? Those sorts of things. So ask your body, what does it like doing the best? for people who are like really active and like to touch people, I like to tell them, think about physical therapy or physical therapy assistant, occupational therapy assistant, that kind of thing. People who want to be directly helping patients in like medical assisting or nursing, that kind of thing. Those are other things to think about. So think about yourself and your body. You're the best expert on you and what you've liked so far in your life. So think about those things. Will there be jobs available doing what you like to do? And the quick answer on that one is, if it's healthcare, yes, there will be jobs. So with very few exceptions, there will be jobs in most things that you're interested in. I'm just going to pause for a second and see that are there things in the chat that I should be attending to?
Nope, don't see anything.
Okay, cool. How much time can you give to education is another important question. And by that, I mean, every day, how much time do you have? That means, are you going to be a part-time student? Or are you going to be a full-time student? And then how many years do you want to spend at it? Or how many weeks or how many months, right? So as we go along, we're talking about Highline College. We're talking about the shortest programs and the longest programs that Highline has. And then you can go on and on and on from there. So like, if you want to be a physician, a doctor, you're going to be in school for 10 or 12 years, right? So that's a very long time. You have to know that that's what you're into. If that's what, I mean, that's the deal you're making if you want to become a doctor, and it's well worth it. But is that something you really want to do? Okay. How will you pay for your education? There are lots of ways to pay for education. So it's worth thinking about that in advance and applying for some of those in advance. Here's a good one, since a lot of you are from Pierce County. How far are you able to travel for school? So if you decide to come to Highline College, there are lots of people who come to Highline College as students and working from lots of different places, Pierce County, all over King County. And they come because it's a great place to be and it's a great place to go to school. But are you willing to do that every day if your classes are every day up at Highline College? Or can you find a partner to drive with? That kind of thing. And if Highline doesn't have the program that you're interested in, are you willing to travel somewhere else? And then another thing to be thinking about is, how many classes do you need before you start the program that you're interested in? Those are called prerequisites. And some programs have them and some programs don't have prerequisites. I'm going to pause right here and see if there are any questions or comments about these general questions that are just for you to be thinking about for yourself.
So Ronnie, you asked if there was any questions in chat, or are we just thinking about it on our own? So I'm not sure.
Oh, do you answer the questions? Yeah, just think about it on your own. And it's really for you. It's not an assignment, but if you want, I can send you the questions, or you can get the questions later and you can really take them as a for real assignment, because you know, it's for your life.
Add, like, right
not
now,
for a grade, it's for life.
In some of our programs right now, we have several students from Bonnie Lake area. We have some students from Tacoma. You know, there's public transportation. They're working on the light rail. Don't know when that's going to be done, but there's a lot of work going on. So there's ways to get there if transportation is an issue.
Yeah, when I take the bus, it takes me 3 buses to get there. So, oh well. Here's the range of healthcare programs at Highline College. The 5 weeks is the shortest thing we have. Well, yeah, 5 weeks is the shortest thing we have, and that's Certified Nursing Assistant, CNA, or NAC. And that's a great thing to do. I have to say that there are programs in Pierce County for nursing assistant as well. So you wouldn't have to schlep all the way up to Highline unless you're planning to keep going to Highline for that one. Other short-term programs we have at Highline are healthcare interpreter. If you speak more than one language, this is a great option for you. It's 1 quarter and it helps you be a more professional interpreter. A lot of people who speak more than one language already translate for their families and their friends, but this would be a way to turn that skill into a career by making sure you're not making mistakes and by getting ready for taking a national exam or a state exam to be paid for interpreting. Adult Family Home Administrator is a 1 quarter program where people who want to have people staying in their home, like as an adult daycare or something like that, or caring for adults in their home. 6 months or up to a year certificates, we have personal fitness trainer and clinic service representative. And I'll say more about more of these later. And then we have 2-year degrees in medical assistant, community health and wellness, personal fitness trainer, and substance use disorder professional. Oh, I forgot to put a slide in here about substance use disorder professional, but that's a really important field too, which is about addiction and chemical dependency. It takes a little longer to do nursing because there's about a year of prerequisites and then it's a 2-year program. And then there's a 4-year degree at Highline College in respiratory care. So now I'll just have a slide on a lot of these programs. Oh, also longer programs, like if you wanted to be a pharmacist or a dentist or a doctor or any of the other really long-term programs, you could start at Highline College for 2 years and then plan to transfer to a university for finishing up pre-med or for finishing up BSN, Bachelor of Science in Nursing, or a lot of these other things that take a lot of years. You could start at Highline and it would be a lot less expensive and probably not quite as hard as starting at a university. Laurel, do you want to say anything else about the big picture?
And also some of our programs transfer in. So like the medical assistant is a pathway for physician assistant. So you would finish a medical assistant program at Highline, work for a while, and then apply to the University of Washington or any other school that has the physician assistant program.
Oh yeah, and Laurel is a good example of somebody who did medical assistant at Highline and then she went somewhere else to finish up a bachelor's degree also. So, right?
Yeah.
Yeah.
Yep.
All right, so CNA is about 5 weeks and it's offered 2 or 3 times every quarter. And there are many, many job openings. You'll see that many job openings at about every single one of these slides. So, and nursing assistant is required to enter the registered nurse program at Highline College. Healthcare interpreter, like I said, requires fluency in English and another language or more than one other language. And although there are many jobs in it, it's sometimes part-time. So for a few languages, there will be full-time work, but it's a good thing to add on to something else. Like if you become a nursing assistant and you add on to this, or a medical assistant and you add this on, it's really helpful.
And it might add additional pay to your hourly wage if you have that.
That's right.
Okay.
That's right. Clinic service representative is a 1-year full-time. If you go to school full-time, it takes 1 year. And there are lots of job openings. That means the person who sits at the front desk of the clinic and welcomes people and schedules appointments and things like that. And then personal fitness trainer has both a certificate and a 2-year degree. So personal fitness trainer are the people who help people be healthy and exercise and help them with their nutrition and that kind of thing. Often they work in gyms and health spas and things like that. These students seem to be having a lot of fun, I have to say. The medical assistant program, Laurel is the department chair for that department. It's a 2-year program and there are no prerequisites really, except for meeting with one of us, one of the advisors. And you have to be ready for college level English. And that's about it. There are lots and lots of job openings for medical assistants. And as Laurel said, it's a pathway to physician assistant. Respiratory therapists, the respiratory therapists are the ones who help people breathe, and they work in hospitals, and sometimes they work in emergency rooms, and sometimes they work in life flights, the helicopters and that kind of thing, or sometimes they work in an asthma clinic, a clinic for children with respiratory problems. And that program is prerequisites for about a year, and then it's a 3-year full-time program. So it ends up being about 4 years. Great pay, lots of jobs, competitive to get into, just like the nursing program, which brings us to registered nurse. Also very competitive to get into, as all nursing programs are. So I recommend that if somebody wants to be a nurse, they plan on applying to a lot of schools because that makes your chances of getting into one of them much higher, right? Don't say, I will only go to this one school. Say, I'll apply to as many schools as I'm willing to travel to, because it'll really help your chances of getting into nursing school. For the RN program at Highline College, it's 1 year of prerequisites, and then you apply to the program, and then it's 2 years full time. And that's typical of nursing programs at the community colleges. Then you can continue if you want to get the Bachelor of Science in Nursing, or BSN, at the University of Washington, Tacoma, or a bunch of other schools that can finish it off for you. Community Health and Wellness is a 2-year degree for people who want to do work like community health worker or patient advocate. This is for people who want to help people navigate the complex healthcare system that we all try to get through, right? So this is for people who may have an expertise in another culture or other languages, or maybe they have a real passion for one disease or one field, or they're interested in public health. So public health is really popular right now because of COVID, and the public health people are the ones that are helping get the whole population better, right? And so that's what public health is all about. And community health and wellness is a great place to start.
10 minutes to go, just heads up.
How many?
10.
10, perfect. Okay, so almost done with the slideshow. So hopefully you students will have some questions for us or some conversation. Lots of transfer degrees. So typically, if somebody wants to do nursing, they do a pre-nursing associate's degree. And they can use that degree for other healthcare programs as well. But if people are thinking about going to medical school or dental school or pharmacy, usually they'll do a 2-year degree, usually with an emphasis in biology or chemistry, something like that. And then they apply to a university. Everybody thinks of the University of Washington, Seattle, but there are so many other schools in the region to think about. That again, if you can, I recommend applying to a bunch of schools so you have lots of options. Yeah. And the other option for nursing. So the first option we talked about is the AAS in nursing, which means a 2-year degree from a community college, Highline, or one of the other schools in the area. So that would be, you get an AAS degree and you get your registered nurse at the end of taking, all of that. And you can start working. But if you want to, you can add on and get a bachelor's degree. However, if you do this, what this slide is showing, it's a transfer pathway, which means you go 2 years at Highline full time, and then you transfer to a university for 2 more years. And at the end of that, you have your bachelor's degree and you apply for your registered nurse degree. So it's a little quicker to go through the community colleges and get the AAS. But this path is just as good, and you have lots of job choices for either one. Either one of them will get you where you want to be. It's just a choice. And then reminding you that there's a healthcare exploration for youth summer program that we have through Highline College. Most of it will be virtual, but you'll be on campus a couple days a week for learning healthcare skills. And I'll put the thing in the chat in a few minutes. And you have to be qualified by being low income, and you have to be between 16 and 24 years of age. Also want to mention there are lots of other schools in the area that have more choices for healthcare programs. Pierce College, a lot of you are in Pierce County. So look at TCC, Tacoma Community College, and Pierce College. They have lots of cool programs as well. If you haven't seen a presentation by them yet, check it out, because they have lots of alternatives to what Highline has as well. And then this slide just shows a bunch of ways for you to study different healthcare careers and different healthcare programs. And I don't know, Kevin, do you know if the presentations will be available to students so they can follow up with some of these things?
Yes, I believe so. Okay. We're uploading the recordings of the presentations to a Google Drive folder, and I think that they will be sent out to you afterwards, so you can review everything that's occurred in this presentation.
Great.
Very good.
And then just my last slide is just about findyourpath.highline.edu, which is a for all our professional technical programs at Highline College. And let me just stop sharing, and I will put that link for the healthcare exploration for youth in the chat. And all right, people,
questions?
it's time for you to talk. Whoops, I just sent that to Laurel only. There we go. If you go to that website that I just put in the chat, you can type in your information and find out if you're eligible for the program, and you may get in. I manage that program, so I'd love to see you at Highline this summer. So